a little bit slower in Nebraska, so I apologize for that slight delay. Welcome to the webinar about exercise and multiple sclerosis.
All right, thanks, Mandy. As everyone heard, the webinar is being recorded. My name is Maureen Martin, and I'm the Programs Continuum Coordinator for Can Do Multiple Sclerosis. First, I want to thank you all for acting on the belief that you are more than your MS by attending tonight's webinar, Exercise in MS, with Mandy Rohrig, who you just heard. I want to begin the presentation by talking just a little bit about Can Do Multiple Sclerosis. Can Do MS, formerly the Hugo Center for Multiple Sclerosis, is an innovative provider of lifestyle empowerment programs for people with MS and their support partners. We are the start of a whole new way of thinking about and living with MS. A national nonprofit organization, we empower people to move beyond their MS by giving them the knowledge, skills, tools, and confidence to adopt healthy lifestyle behaviors, actively co-manage their disease, and live their best lives. Our renowned programs have helped thousands of people with MS reclaim their dignity, control, and freedom, and transform their challenges into possibilities. Can Do MS recently launched our new website, www.mscando.org. Please visit our new website where you can register for upcoming webinars, listen to archived webinars, check out our upcoming Can Do MS lifestyle empowerment programs, share your Can Do promise, and learn ways you contribute to or get involved with Can Do MS. Just a few housekeeping items before we get started. This presentation is being recorded, as you all heard, and it will be archived on the Can Do MS website. And you're more than welcome to view the presentation again, and if you miss one of our upcoming webinars, you can find the archived version on Can Do MS's website. To ensure good sound quality with no background noise, all of the participants are in listen-only mode for the live presentation. Although your phone lines are muted, you still have the capability to submit questions to Mandy, and we encourage questions at any time. So feel free to type your questions using the chat feature located on the left side of your computer screen. You should see a box on the left side of your computer screen that says chat. And to submit a question, you actually type in the small box that says chat with presenter. And Mandy will address as many questions as time will allow at the end of her presentation. So the job of the live participants tonight is to, number one, submit your questions. Number two, complete the evaluation at the end of the webinar. And number three, review the webinar schedule and register for the other Can Do MS webinars. We'd like to thank Novartis Pharmaceutical Companies. The Can Do MS webinar series is sponsored by an educational grant from Novartis Pharmaceutical Companies. So we have a great speaker tonight to talk about exercise in MS. Mandy Rohrig graduated from Nebraska Wesleyan University with the Bachelor's of Science in Exercise Science and a minor in Spanish. Following her undergraduate education, Mandy received her doctorate of physical therapy from the University of Nebraska Medical Center in Omaha, Nebraska. She is a member of the American Physical Therapy Association's neurological section. Mandy currently works in an outpatient physical therapy setting where she specializes in the rehabilitation of individuals with neurological conditions with a special emphasis in the treatment of individuals with multiple sclerosis as well as balanced vestibular disorders. She is actively involved in the MS community in Omaha, Nebraska, regularly consulting and presenting among local MS exercise and support groups. So we're really excited to have Mandy do this presentation tonight. Before we get started, just wanted to do a quick survey to see who is on the webinar with us tonight. So we just put a survey up on the screen. Go ahead and submit your answers. We ask if you are a person living with MS, a support partner, a healthcare provider, or other. So we'll give this just a minute or so to let everyone get their answers submitted. And then we'll close the poll and look at the results. All right, we've had just about everyone give an answer. Give a couple more seconds. All right, so that's great. We have 92% of the people on the call tonight is a person living with MS. We have about 9% are support partners. A little over 5% are healthcare professionals, and 4% are other. That's a great group we have. And with that, I will turn it over to Mandy.
Great. Thank you, Maureen. Again, my name is Mandy Rohrig. I'm a physical therapist out of Omaha, Nebraska. I am pleased to be speaking with you all this evening with my topic regarding exercise and multiple sclerosis. I've been with the Can Do program for about 4 years now and enjoying every minute of it. So thank you for allowing me to visit with you guys this evening. The objectives of the presentation this evening involve understanding why exercise is effective in the management of multiple sclerosis symptoms. More specifically, we'll understand neuroplasticity and discuss neuroplasticity, learn the benefits of exercise in the management of multiple sclerosis, identify specific components of an exercise program, and lastly, learn examples of exercises. So to start with a review of what multiple sclerosis is. So multiple sclerosis impacts the central nervous system, which consists of the brain and spinal cord. So there's a sheath insulating the nerves, the brain and spinal cord, called myelin. And that myelin sheath allows for the nerves to conduct impulses at a very quick rate. So what multiple sclerosis does is impacts that myelin sheath surrounding the nerve. So here's the nerve, and there's the myelin surrounding the nerve. And here's just a second picture comparing a nerve not impacted by multiple sclerosis on the top, and then a nerve impacted by multiple sclerosis. So the example here is where the MS has influenced the myelin in this area, and it has slowed the nerve conduction. So when the impulses are slowed, the nerve fatigues very quickly, and that can result in MS symptoms such as numbness or tingling, weakness, blurred vision, etc. Here's another diagram explaining a neuron. And what I want you guys to acknowledge specifically is the dendrite, the axon, and then this group of cells here at the end, and also the myelin. We've also briefly touched on myelin already. So the nerve impulse comes in through the dendrite, travels down the axon, and it's insulated as it goes down the axon by that myelin. And at the end, this is the synapse, where the axon terminal is. The synapse is where it communicates with other nerves. So now what? After an acute attack of multiple sclerosis, here are a few concepts of what may happen following such an injury to the central nervous system or to the brain and spinal cord. So swelling and inflammation may occur first around the lesion and may not actually be impacted by the MS directly. So the swelling surrounding the area can reduce, and the impulses will resume. The second point there talks about remyelination. So there is some thought that cells can survive the multiple sclerosis attack and therefore assist with remyelination. So this is thought to occur more commonly in the early stages of multiple sclerosis. The third bullet point talks about scarring. So often those areas where there is myelin that has been damaged and there is a gap in that myelin insulation, that can be filled with scars, so the scarring can occur. And the last bullet point discusses that more recent research is suggesting that there can also be damage not only the myelin surrounding the axon or surrounding the nerve, but also damage to the axon itself. And all of these together can result in potentially some brain atrophy or brain shrinkage. So on a slightly more positive note, there is potential for formation of new receptors at existing nerve endings. So in other words, back to our diagram here, there are these nerve endings, and those nerve endings you can potentially have new ones that will allow for more communication between nerves or those synapse areas. Also, the second bullet point notes you can also have unmasking of previously unused adjacent nerves. So in other words, you have millions of nerves within the brain side by side each other. And if there's one nerve that was impacted by the multiple sclerosis and the other nerve not far away, those undamaged nerves that were potentially not previously used for a particular purpose can be kind of awakened and retrained for a new purpose. So these two concepts encompass what a term we use called neuroplasticity. Neuroplasticity. So what is neuroplasticity? Neuroplasticity, the definition, textbook definition we'll say, is the ability of the neurons to change their function, chemical profile, or structure. And in much simpler terms, the brain and the nerve connections within the brain are constantly changing. And the brain is not static. It used to be thought that the brain grew, and once it was matured, it stayed the same. Well, now we're finding that it's constantly changing and adapting, given the right conditions. So those individual nerve changes that we spoke about in the previous slide together impact the brain map or the overall brain function. And what's very encouraging about this is that exercise may facilitate these processes, may facilitate this neuroplastic changes or this brain reorganization, encouraging changes in the overall brain map. So this new concept now of brain map and neuroplasticity. So what is a brain map? This is a diagram representing a very small portion of our brain, which may be larger for some others, and myself, called the primary motor cortex. So what this diagram shows is the brain down here, and then they took out that sliver in the slide above. And what you'll see is that different parts of the brain are responsible for different parts of the body, in this specific area, motor parts of the body. So as you can see, the hand has many, many functions, so it has a very large representation in the brain, in the motor part of the brain. So now how does the brain map and neuroplasticity relate to one another? So those cortexes, or those little areas, those slices within the brain, they can correlate to sensory areas, so touch and vision or balance, and the motor areas constantly changing. So the brain is constantly changing and adapting, and areas of representation can be much smaller or larger depending upon the person. They're very individualized. The brain areas are constantly reorganizing as well, and they're based on learning, experience, memory, disuse, and damage from multiple sclerosis, but more importantly, practice. So a great example they've demonstrated, and you hear a lot about in the literature, is the finger motor area, so the area that allows for fine motor skills in the right hand of a right-handed guitar player, for example, or a right-handed individual, is going to be a lot larger area of representation than someone who is that person's left hand. So again, that running theme, exercise and practice may facilitate these brain reorganization processes and may influence the brain map, and it may influence neuroplasticity. I was very optimistic. I recently heard a neuroscientist speak about a week or so ago, and he's also a practicing physical therapist. He had reported that these areas of representation in our brain are changing as often as potentially every 1 to 2 days. So very exciting that we can make changes to our nervous system. So a little bit more information about the brain map and neuroplasticity. So the inflammatory chemicals in the brain have been noted to reduce with exercise. The extent and type of brain reorganization varies across individuals and at different stages of the disease. So the sooner we can impact the brain map and the sooner we can start making some positive neuroplastic changes, the better. Brain reorganization has been shown to occur after a single multiple sclerosis attack. Very encouraging. And as research continues with the use of functional MRIs, we can hopefully more precisely fine-tune our exercise strategies. So as a rehabilitation professional, this is very exciting because hopefully we can become a little more savvy and understand a little more how the brain reorganizes in response to specific exercises. And hopefully, in turn, this will allow us to more precisely provide exercise prescriptions to elicit a very specific or desired response. And this slide has quite a lot of beef to it, so hang on, folks. Here we go. Exercise research and brain health. So specifically, exercise may impact insulin-like growth factor. Insulin-like growth factor is a chemical protein in the brain that has been shown to influence and modulate brain growth and potentially central nervous system myelination. So we think it could influence neuroplasticity. We think potentially it could to have a neuroprotective effect at the synapse and within the myelin. Second protein to note is the brain-derived neurotrophic factor. It is thought to play a role in the regulation of the axon and dendrite branching and their remodeling. So just to remind you guys, the dendrites are where the information comes into the nerve, and the axon is what the myelin is insulating. So that brain-derived neurotrophic factor, or BDNF, may help with some of the remodeling that occurs within those parts of the nerve. Lastly, exercise may also impact nerve growth factors. More specifically, it's thought to lessen cognition and help with memory. So I think what is very important to remember is not these fancy proteins and all of these acronyms that we create, but rather to understand that research is starting to isolate certain proteins that are changing in response to exercise. And those proteins are having a positive impact on the brain and the nerves and the axons. So very exciting. So what I hope you guys took from the first part of this is that exercise can potentially change the body as well as change the mind. Now, I have to give credit where credit is due. Brief history of exercise and multiple sclerosis. I don't want to give a history lesson today, but I want to acknowledge where we've come from and where we have yet to go. So, it wasn't that long ago that individuals diagnosed with multiple sclerosis were told by rehab professionals and healthcare providers to just sit back, relax, and don't move, because it just might make symptoms worse. Well, fortunately, that was wrong. We've proven that wrong. And fortunately for Jimmy Huga, because he was one of the leaders in the revolutionary concept that exercise is effective for the management of multiple sclerosis. And in 1996, which really wasn't that terribly long ago, we had the first medical literature citing that there were measurable benefits of aerobic exercise specifically, so heart and lungs, and that it was effective for people with multiple sclerosis. And even more fortunately, hundreds, potentially thousands of articles have since followed supporting that exercise and multiple sclerosis is very valuable. And here is our very own Jimmy Huga. I just want to take a moment and share my story with Jimmy Huga. I know he's influenced a lot of people over his lifetime, but the first time I met him was at a 5-day can-do program. And I remember I had the honor of sitting with him at a table during one of the many meals, wonderful meals we have at 5-day can-do programs. And we got to visiting, and he was sharing his story about when he was first diagnosed with multiple sclerosis. And Jimmy told me that his healthcare provider told him, like many other healthcare providers, that I know you're an Olympian, I know you're in good shape, but exercise can make things worse. You better just sit back, relax, and try not to move too much. And I remember Jimmy told me in very choice and candid words, we'll say, that he liked exercising and he was in better shape than most of the people who were telling him to sit still. And he wanted to continue exercising because it made him feel better. Fortunately for all of us, he did not take those recommendations. And he eventually developed the Huga Center, which of course now is Can Do Multiple Sclerosis, and all of us get to continue to enjoy his legacy. So thank you, Jimmy. So again, we can exercise the body, potentially change the mind, but why? What are the benefits? How can we do this? What are the next steps? This is a nice, concise diagram that describes the potential role of exercise and the categories that exercise can potentially influence. You can see the laundry list of functional benefits, including fitness, mobility, balance. I'll let you guys read those on your own. The potential effect that it could have on the brain and the anti-inflammatory or immune system influences that exercise may also have as well. I think what's important to note about this entire diagram is not the details of it again, but rather that each category influences disability and influences quality of life. So overall, we can look at this and say exercise has the potential to influence disability and enhance quality of life. But let's get to the bottom of it. Let's get to the meat and potatoes of it, as we say in Nebraska. What are the benefits of exercise? Primarily, what I look at are physical improvements. So physical improvements including walking ability, maybe muscular strength, maybe improvements in your ability to balance as a result of exercise. Another benefit of exercise, the literature states, involves emotional changes and depression. Depression can impact upwards of 60% of multiple sclerosis in the literature that I have read. Now, I'm sure you could find statistics that are higher or lower than that. But it has been noted that chemicals released during exercise have been shown to reduce stress and, more importantly, reduce depression as well. The third bullet point talks about bowel and bladder function. Exercise can influence bowel and bladder function, specifically with regularity. And I will let the expert talk about that. Pat Kennedy's next webinar, I'll give her a little preview, will be about bladder function. So she will hopefully talk a little bit about how exercise can also influence that. The last bullet point is general health benefit. So general health benefits such as blood pressure, cholesterol, bone density, all of that good stuff. So there's a general health component associated with exercise that's very critical. I have the privilege of doing some consulting work at our local multiple sclerosis gym here in Omaha, and I tell the owner of this gym, I say, I am always impressed with how healthy these participants are. They're managing multiple sclerosis, but they're not managing other conditions like cholesterol issues or blood pressure issues like their similarly aged counterparts may be managing. So exercise can control some of those general health issues as well. A few additional benefits of exercise involve cognition, mental functioning, and memory. So it's been shown that participation in regular exercise helps with preservation of brain volume. And brain volume has been suggested to be associated with better cognitive function. So hopefully you have a big head, I guess we can say. More specifically, cognitive difficulty has been shown in 45 to 84% of individuals with multiple sclerosis. Very wide statistical range there. But it's common. Studies have indicated that higher fitness levels are associated with higher cognitive testing and greater brain recruitment. So essentially the brain is a muscle too, and exercise may hopefully kind of counteract some of the brain atrophy or brain shrinkage that we had mentioned the disease process can influence in the earlier slides. The last bullet point discusses exacerbation and recovery reduction. So individuals with multiple sclerosis who exercise regularly often will recover a little better from an exacerbation. And this is based on a preconditioning theory. The preconditioning theory is a theory that suggests that the cells in the central nervous system, if they're exposed to low-dose stressors, so in other words, low-dose stressors that you get when you exercise appropriately, those cells become more resistant to harmful effects of a more severe stressor, say, for example, a multiple sclerosis exacerbation. In essence, these nerves and these cells can be better conditioned to avoid injury or even cell death. So it has been suggested that exercise may help kind of condition the cells of the central nervous system to better tolerate injury or damage. So we've covered the benefits of exercise, the potential benefits. We've talked a little bit about the history, a little bit about what's happening in the brain potentially, how neuroplasticity is influencing, and how that overall is influencing our brain map and brain reorganization. But now let's get to the bottom of it. How can we start influencing and making these changes in our own bodies? So there are 4 primary components of an exercise program. The first component is flexibility. The second is strength endurance. Third, balance and coordination. And lastly, cardiopulmonary endurance. And these are in no order of importance. So as we go through each one of these components of an exercise program, I'm going to use general guidelines. And we love acronyms in medicine and in healthcare. So the principle we like to use is the FIT principle, F-I-T-T. Frequency, intensity, time, and type. So frequency, how often should you exercise? Intensity, how hard? Time, of course, is how long should you exercise? And the type or specificity is what type of exercise is most appropriate to you. So I want to take a moment to just say exercises need to address deficits and concerns that are important to you. They need to have a functional application to your life. So what may be important to one person may not be important to another, but that functional real-life application needs to always be considered in an exercise program. We'll start first with flexibility. So flexibility involves improving muscular range of motion. Flexibility exercises are thought to help manage spasticity. Spasticity is that tightness and that muscle restriction or spasms that you may feel, some of you may feel. We recommend flexibility exercises to be completed daily. And again, these are general guidelines, so they may be more or less depending upon what you need, but daily. For some of my patients who have multiple sclerosis in my practice, I recommend more often than that if they have high levels of spasticity. The intensity is a minimum of 2 to 3 repetitions, and each of those repetitions should be held for a duration of 20 to 60 seconds. And again, that can be lengthened or individualized as needed. The type or mode of exercise that you can use. Clearly, you can stretch individually with a partner or with equipment such as bands or positioning devices, things like that. So, is this too much? If God had wanted me to touch my toes, He would have put them closer to my hands. Does anyone feel the same way? Here are some examples of a few flexibility exercises. I wanted to demonstrate to the audience, to all of you, that you can stretch in a variety of different positions based on your needs. So the calf stretch, or a calf stretch, is the calf, let's start there, is the muscle on the back of the lower leg. I hope you can see my highlight. So here's the back of the lower leg there. And this gentleman in the first picture on the left uses a wheelchair for primary mobility, and he has his foot propped up on another chair and is using a cane to kind of help pull back on his toes so he feels a nice pull through his calf muscle. He often uses a cane. He'll often use his reaching device as well. Our young lady on the right is demonstrating a calf stretch for the right leg, again, feeling a pull through the back of the lower leg in a standing position. Both examples of calf stretches, though. Here's an example of a partner stretch, and this partner stretch is for the muscle on the back of the upper thigh now. So if we can see that a little bit, I hope. So the back of the upper thigh, right there. And the person who's assisting her is just helping to stabilize the leg and holding to the point till she feels a nice pull. And again, that's a partner hamstring stretch. We're going to move along to the next category, and that is strength training. Strength training involves improving muscular condition, so whether it be strength or endurance, your ability of your muscles to contract effectively. We recommend this at a frequency of 2 to 3 times per week, although as little as 2 sessions per week has been shown to be effective. Intensity, again, a slow progression is what is recommended. And I specifically like to progress repetitions prior to progressing weight. Again, that can be individualized based on a patient's needs or a participant's needs. But a general guideline would be 1 to 3 sets, 8 to 15 repetitions. And again, I want to emphasize that this is individualized, and a physical therapist or exercise physiologist can help provide quality recommendations. Because energy is often an issue and fatigue can be common in individuals with multiple sclerosis, you don't want to expend valuable energy doing exercises that aren't giving you a desired result. So you don't want to waste energy on exercises that are unnecessary for your situation. There we go. To continue with strength training, time and duration, you can complete it one session. Whoa. Forgive me for a second, guys. There's a slight delay in my computer. So 1 second. There we go. So again, can be completed in one session or multiple smaller sessions throughout the day. But overall, we recommend avoiding excessive muscle fatigue, and you can do that by resting in between sets or alternating between your arms and your leg activities. Overall, recommendations to exercise the larger muscle groups more so than the smaller, more intricate groups. You can use devices such as free weights if you don't have access to weights, or weight machines. You can use soup cans, you can use bands, you can use your own body resistance as ways to improve muscular strength. I wanted to comment on respiratory muscle training. So respiratory muscle training, or deep breathing, involves strengthening the muscles involved with breathing. So there are devices out there that can help measure how well you're breathing in or out. The nice thing is with respiratory muscle training, if you're an individual who uses a wheelchair and perhaps have more difficulty getting on and off equipment or utilizing equipment, deep breathing can be an effective option for strength training for you. And the research supports this. So breathing muscle training, or respiratory muscle training, twice daily for 3 months has been shown in the literature to help improve both inspiration, so breathing in, and breathing out muscular strength. And the best part about it is it was getting a little bit of functional carryover into an individual's ability to cough, and this even extended beyond the actual study. So they noticed it for upwards of 6 months, even after stopping regular exercises. But again, I think what's most important to note is that you need to exercise to encourage function. And I already spoiled this one by my trigger finger, but clearly this is not an exercise to encourage function. Bob needs to visit a physical therapist. And here's a gentleman who is showing us how to do a sitting to standing exercise. So for this gentleman specifically, he has difficulties getting in and out of chairs. And in order to strengthen the muscles involved with that activity specifically, we've elevated the surface that he's standing from and allowed him to practice that motion so he can strengthen his muscles in a very functional and appropriate manner. Now, for example, an individual who would also have difficulty getting in and out of a chair, but perhaps wouldn't feel comfortable with the balance required of a sitting to standing exercise, we can also do a bridging exercise. So this top one is the first picture, the starting position, and essentially what it involves is lifting the bottom. So this is strengthening muscles on the back of the leg, through the abdominals, through the buttocks. It's a good all-around exercise. And here's an example of a core strengthening or abdominal exercise. So when you hear that fancy word core, it's very popular in the fitness world now. That involves about everything below your armpit or your axillary area and down to your hips and buttocks. So that encompasses the core area. But this specifically is an abdominal exercise addressed to help this gentleman with getting in and out of bed. So he has difficulty sitting up, so coming from a laying down position to a sitting on the edge of the bed position. And he can do this from his power mobility. Third system involves balance and coordination. The motor systems, these are pretty intuitive. It's the first category of the balance system. And that involves strength, flexibility, coordination, and timing, all of those of the muscles specifically involved with balance strategies, so within the legs or within the trunk. The second category involves the sensory systems, which involves three primary areas: the eyes, the inner ear or the vestibular organs, and the touch pressure sensation from the feet and the joints, which we specifically call a very large word, somatosensation. So it's that touch and pressure sensation that you get from contact, that tactile cue. So visual acuity, obviously the eye portion, allows you to see and anticipate what you are going to need to do to react to remain balanced. Makes sense? The second component is the inner ear, the vestibular organs. It primarily involves two organs that interpret, one that interprets rotational movement and one that interprets more translational movement. And these organs together communicate with the eye muscles as well as all the parts of the brain and postural muscles. And the last system is that tactile system that I mentioned. And this is best described in an example. So if you're sitting in a supportive chair, when you're sitting in a supportive chair, you're feeling tactile or touch input from the back of the chair, your thighs, your feet, and all of that information is going to your brain about where your body's positioned. Now, if you sit on the edge of a chair, there are clearly fewer body parts touching the surface, so you have fewer resources for your brain to rely on to orient your balance. But practice of balance involves challenging one or more components of these systems. And again, this is very individualized based on the person's needs. And here's a nice summary slide of all of those systems integrating and working together. So if one or more systems, whether it be the brain, whether it be the eyes or the brain maybe has, or the spinal cord has impacted the legs because maybe you get numbness. If any of those systems are impacted by multiple sclerosis, the other systems potentially can be retrained to raise their level of function and be adapted in order to allow you to continue to feel steady. So a good example that we use is if you have difficulty walking in a dark or a dim-lit room, you aren't able to use your vision or your visual acuity quite as well for balance because it's dark or dim-lit. And say the multiple sclerosis has caused numbness in the legs. If you need to get up in the middle of the night to go to the bathroom, the lights are off, you have numbness in your legs, you're relying on less, so we have primarily that second system or that vestibular system that we're relying on for balance. And that's simplifying it quite a lot, but it gives you an idea of how our nervous system rearranges based on the environment. So here are our lovely ladies demonstrating a few balance exercises for us. The first one is a gal sitting on a large exercise ball. So again, this is challenging the somatosensory the touch system. The second one, again, challenging the somatosensory. She's standing with her feet closer together than she likes, so there's a smaller base of support, less input to the brain about how it can orient balance. And even more challenging in this third picture, because she's on that evil pillow. That really challenges it. The muscles and nerves and the legs are a little bit more compromised and can't give quite as accurate information to the brain about where the body's at in this third picture as it can in this picture, because it's a firm surface. Again, these can all be very much individualized, and I didn't give any specifics on how often you should practice balance exercises, because that is so individualized, and what is specific to you is what you'll need to work on and address. The last component of our exercise program is cardiovascular exercise. Recommended frequency of 2 to 3 sessions per week, minimal. You can base your intensity of cardiovascular or heart and lung exercise based on heart rate or based on rate of perceived exertion. As you can tell, we don't recommend the heart rate quite as much because it's not as accurate with heart medications, and also the fact that quite often people who have multiple sclerosis, also their nervous system may impact the ability of the heart rate or the breathing to adjust the exercise. So sometimes the heart rate's not always an accurate, reliable way to gauge intensity. But if you're in love with your heart rate and you want to take it, there are a couple guidelines for how hard you should be working. Rate of perceived exertion. The rate of perceived exertion is a 0 to 10 scale that everyone's pretty familiar with and is easily implemented, as it's very similar to the pain scale. And this next slide will show you how that rate of perceived exertion scale works. So each number correlates to a particular intensity that you feel you're working at. So perhaps if we're just sitting here, we're very relaxed, you're listening to this presentation, hopefully not too relaxed though. You may feel like you're at a 0 or a 0.5, but as you start to get up and move around and do some physical activity, it may creep up to more of a 3 out of 10 rating. Cardiovascular exercise, some general guidelines for how long you should do it. I know this seems like an enormous amount of time sometimes, but these can be broken up into multiple sessions per day. I have started individuals as little as 3 to 5 minutes, and then you just gradually increase the tolerance. It's not how much you can do, but what you can do is what matters. Warm up and cool down, a couple recommendations for how hard you should be working based on your RPE scale. And then a couple of ideas as far as what types of equipment you can use to exercise. But this is important to note too. Your response to exercise is physiologically the same as someone without multiple sclerosis. So you can reap the same rewards from exercise as someone who doesn't have MS. A couple examples of cardiovascular exercise. This gal right here is using our arm bike, and this gal's using a new step machine, which is like a seated stair stepper, much more comfortable than a stair stepper. A few general guidelines. The no pain, no gain principle does not apply. Please do not let anyone tell you otherwise. Cooling devices before, after, and potentially even during exercise have proven very valuable. One article indicated that daily cooling for 1 hour for 1 month, patients experienced improvements in their walk tests, improvements in their overall fatigue levels. So cooling is very important. You can use cool packs, you can use fans, you can use misting devices. I want to jump down to that third bullet point to consider time of day. If you're better in the mornings, exercise in the mornings, or exercise after rest. And lastly, fatigue. Recognize that there are good days and bad days, and it's okay to have an exercise program for each day, and it's okay to manipulate and mold your program based on your needs. But most importantly, and I say this in the clinic a lot, more is not necessarily better. So do what's best and do what's right for you. If you're at a point in the management of your multiple sclerosis where you are interested in initiating an exercise program, and I hope this has encouraged all of you to do so, contact your neurologist and ask for a referral to an exercise physiologist or a physical therapist. Another good resource would be checking the National MS Society local chapter. Ask them for some physical therapists in your community or nearby your community who work with individuals with MS. Another good resource would be the American Physical Therapy Association, and that website is www.apta.org. So apta.org. You can search for a neurological physical therapist and somebody who can help you out with developing an exercise program. So in summary, exercise facilitates brain reorganization, and we have discussed numerous benefits of exercise, and I hope you can discover your own benefits. There are four primary components of an exercise program, and lastly, exercise is for everyone, and exercise is unique to everyone. And lastly, you can exercise. In the words of Jimmy Hugo, you can do it. You can exercise. Any questions, comments?
Wow, that was great, Mandy. We have a ton of questions, so we'll get through the ones that we can. And then for everyone whose questions are not answered, we will get you an answer, within the week or so. So Mandy, will start with the first question, and it is, should exercise routines be changed periodically to stimulate other parts of the brain and other nerves?
Wonderful question, whoever asked that. And yes, I would encourage your exercise program to be changed, not only in response to your disease, but also in response to exactly what you said. You always want to be challenging the brain. You always want to be changing your nervous system in a variety of different ways in order to maximize your function. Wonderful question. Thank you, Maureen.
Great. So here's another good question. I've been working out for 5 years now since I was diagnosed, and there are some days where I'm much weaker and can't lift as much. Am I still getting benefits from working out when I am very weak?
I'm going to answer that question with two parts. Yes, you can exercise when you're feeling a little bit weak, but you may need to modify your program. And secondly, I would comment that if you are that significantly weak, it may be a day to have a different program, to maybe downgrade a little bit so that you don't have what I like to call exercise hangover, or where you push too much and then you have to pay for it with excessive fatigue the next day. So that would be my two comments.
That's great. And we've received a couple questions, so I'm just going to kind of sum it up into one that says, how do we handle the exercise-related heat?
Good question, and that's an ongoing challenge, I'll be honest, that I encounter every day in my own physical therapy practice. And the best recommendation I can make is either A, don't exercise in the heat, but if that's unavoidable, I would really encourage you to get some cooling devices. Cooling gel packs are personally my favorite, and the favorite of the patients in my office, that you can wrap around your neck. There are cooling devices you can put around your wrists. I even tell some gals to put it underneath their shirt and kind of wrap it around their midsection if that seems to be where they're warmest. Another recommendation that I would have is even hop in the shower or cool your body temperature down quite a lot before you exercise, so that your body temperature drops, and then when you start to exercise, it won't be such a dramatic influence.
All right, that's great. We received a couple questions on these also. I have foot drop, So what types of exercises can be done to strengthen the thighs and leg muscles to help pick up that foot?
Sure. Well, that's a bit of a difficult question in the fact that foot drops can be very individualized to the person. But as one of my primary exercises that I give for individuals who have foot drop is that calf stretch that I gave. So depending upon this person's mobility or these individuals' mobility, a calf stretch would be an important one to start with. But I would even recommend a little bit further to go see a physical therapist who works with people who have MS and look at some of the other devices that they have out there. We've got the walk aid. We have the Bioness L300, which is a foot drop device. A lot of good electrical stimulation tools out there that have been helping people with foot drop as well.
Okay. Can you repeat the website for the exercise therapist that you gave out?
Sure. It is www.T as in Paul, T as in Tom, A.org.
All right.
And then also just contacting the local chapter of the National MS Society or even the MSAA could steer you to some physical therapists or exercise physiologists.
Great. We probably have time for a couple more questions. How about this one? What is the harm in overexertion?
In my opinion, the harm of overexertion is there's no direct harm that they've been able to document in the research. Overexertion, it goes back to that comment, that phrase I like to use, exercise hangover. You will likely feel extreme fatigue following that, and it may take you a long time to recover. My general recommendation for people is that if you can't recover from an exercise program or an exercise routine within 1 to 2 hours, then you probably overdid it. If it takes you longer than that, then you probably overdid. Good question.
That's great. So the last question, and there were a couple that were sort of related. For MS, would you recommend Tai Chi, Pilates, or yoga?
Oh, wow. They're all wonderful in their own right. I know Eric Small is an individual with multiple sclerosis who promotes a particular type of yoga, and I know individuals with MS who practice yoga on a regular basis, and it feels that it really helps them with their spasticity, their stress management, relaxation, even a little bit of balance. Tai Chi is designed to help with balance, so that may be an avenue to explore if balance is more of an issue. And Pilates is more for core strengthening or for strengthening and of the midsection. So I guess it depends on the needs, but all of them are very appropriate depending upon what the person wants to address.
That's great, Mandy. And do you have any just kind of closing comments or last thoughts for everyone?
Nothing specific. I guess if you guys have any additional questions that you want asked, I'll let Maureen comment on where those questions can be sent, and I will address those as soon as I can, preferably via email. And thank you all for listening this evening. I appreciate everyone's attendance.
All right, thanks, Mandy. And I have record of everyone who submitted questions, so we will take care of those, and we have your email address. I just want to thank everyone who joined us on this webinar. We had a great turnout, and we're really excited about our upcoming webinars. Also want to just thank Novartis Pharmaceutical Companies again for sponsoring this program. The next webinar is scheduled for October 12th, 2010 at the same time, 8 p.m. Eastern, and the topic is bladder function, and the presenter is Pat Kennedy, CanDo MS nurse educator. So you can register for this webinar at www.mscando.org. And for those participating live tonight, as soon as the presentation is over, you will see a survey appear on your screen. And please take a moment to complete the survey and help us continue to improve this webinar series. We value your feedback and input. So thanks again, and have a great night.
Thank you. Please stand by.